that's never failing. Let mercy fall on me. Everyone needs forgiveness, the kindness of the Savior, the hope of nations. Savior.
This is Chariot TV.
Yeah, my money now called by the Chariot TV. So action time. Jumedi you didn't kwesi ada anywhere bia no watch eboa ya ba ebe pensen one or two things emu topics are usually no a year of interest to imebun na ewo onyankopon asafo ne no. Last week ye share adesua bi ase na ye share abortion in a year in three perspectives. Na last week it's if one year for omoba de omuhu na so mo dia a course. This week ye besa ye sounds what was so enti safe no waba ye se akonya na share ye content no baby a wo hwe efi bia no. We actually live program no live on Facebook. It is live on YouTube. It is also live on Twitter. So wherever you are watching us from, I think Twitter, and I'm not quite sure, but for Facebook and then YouTube, we are live on those platforms. So share, like, and invite your friends to the program. Last week, Dr. Listowell Sarfo, and then so Nyankopon Adom wasanso abekamensa. And to me, when we invite Dr. Abba platform also. Good evening, Dr. Sarfo.
Good evening, brother.
Na apome.
Adumo, Nyankopon ja, another room, your points are in che, into no, Yanshra, Nyankopon way so. Yeah, now so.
Nyankopon Adom, yada was say, and then swajibre. Na, I know, say you are very busy, but despite that, and a year kwesiada and all that, you still made time for viewers on Action Time. We really appreciate you so much, and on behalf of Action Time viewers, that was last week. Odiyen efa disua bimo na responses was really positive. We talked about the medical viewpoint of abortion. You actually gave us the definitions, the medical definition of abortion. As being the termination of pregnancy, also the historical background of abortion and how abortion even started. And I quite remember, so you made a point that it really stuck with me, that before that there was a statement back in Genesis, the thoughts and the intents of man was increasingly evil. So because of that, so as part of those things, you try to connect and link the practice of abortion to some of the practices that was endemic during those times. And now so it's really telling, looking at how far we have come as a human race. And you also give us the different types of abortion. But for the sake and for the benefit of those who were not able to join us last week, I just want you to, within 2 minutes, summarize a few things that you think are of note. So that in a discussion, people who are joining in for the first time would benefit from it as well.
Okay. Yeah, me that's it, brother. Mr. the Chariot TV, I say about me quine. Say minimo emeche sa nimdie na ema hwa e wo sa kwan so. Ubisa no kre say last week na ye sua say because abortion ye were two main types of abortion. We have the spontaneous one spontaneous one said and one I wore the kind of abortion and also any panoano if you know pay no idea be was say abofrano. Now you can say abortion has gone through stages in terms of acceptance and then making laws against it. Now so kind nipa brain if you Bible more it started from there. People have always been disobedient. People have always been wicked and evil when it comes to say intentionally, more a year bonnet. And about a year, this part of the world, the western part, and even Africa, abortion has always been part of what of people, and my say should a shenko for a momo say last week can say in the depression era they made it open. Say my day now one point that me stress it say they did that not on moral grounds.
Okay.
They did that not on moral grounds. And you say we are to ease themselves. They wanted to have what was going on. Think about this. I will say maybe a Bible more come see ya or baby any necra ne bam ya I from we and I feel no better the baby day every that's the same idea. And you say be a morally right for them to now but bonnie nipa bonnie or internet estate from that aspect. And I about Mr. Stress about abortion a very sensitive topic. And most of the time we have to caution people, say they have to guard themselves. Now if open up open up now omunyi adwen bi a be prevent you from hearing and nema e bi be boa even especially my so crucial important say be bro ho ase na afi ebetimi aka ho asem sebe ya say mo bi kro na ebetimi de be aboabo e ho wo sa kwa no so into those two different types especially about spontaneous abortion e ka say no e bia abofra no ano ni nyine mu no na anye ne no idea be aba e bia ya we bia de wo ba no ne no betimi idea be no betimi aba and elective one so the nipa na pem visa abofra no on pe no ko nego for some reasons e bia later never discuss it into no me say it of a woman the American afa hono no.
Okay, thank you so much. So just moving on straightforward. So last week Nikai you said even from your summary say your two types were the spontaneous abortion and after miscarriage, and then we have elective abortion and after the more doctors for you are really mandated and as more usually you carry out. So last weekend we said some of these practices they are usually carried out. There are several ways people carry out some of these practices, but I want us to stress the fact say abortion in itself first and foremost, the definition of abortion does not make it morally right. I want you to clarify that point, and I say emphasize that point to our viewers. Say the whole idea of abortion, as you gave us the definitions, the terminating a pregnancy. We are not looking at the termination by the body and as the spontaneous abortion. Any other form of termination, with the exception of say body nankasankasa and I say an accident to be asing, the intentional termination and yet something that is morally right. I want us to set that premise from the word go. So if you can emphasize on that quickly before we proceed to today's topic.
Oh yeah, definitely. Definitely. you know, Bible no say no man can the obapa bone, you know, and you know, like elective abortion said or the delivery abortion, wow, what feel permissible be yeah, it's very, very wrong, you know, it's morally wrong. Yeah, if you can moral crime now, we're not talking about Christianity or Muslim, or we're talking about morality is an absolute acceptance of what people have come to know to be true and right, upheld by society of high standard. Okay. So that is morality, and that is and again, morality and America and other nations are against the Nazis of Germany. You know, the German was saying, say, you know, the Jews are nobody, you know, we can kill them. It is our own law. When the Nazis were making that crucial statement, they say, nobody can bind their law on us as a nation, because we have the singular right to obey and carry out our own law. And guess what? When the Supreme Court met, the statement in May said there's a higher power above all powers.
Yeah.
You know, and they reference what? The moral integrity of law upheld by almost every society. And to know your kind of morality, you know, yes, Christian they defend morality. I will say every nation must defend. But morality, it is not, you know, it is not singular to Christianity. Morality, you know, is something that the whole world accepted as what as true. In fact, and that is why abortion for so many years was illegal in almost every nation.
Yeah.
Because they believe in what? In morality, whether you are a religious, a spiritual person or not. So yes, you know, abortion, elective abortion, deliberate abortion is definitely wrong.
Okay. Thank you so much. Preacher, the doctor. Yeah, we really appreciate that. So, moving on from there, no, I remember last week we kind of said some people we shouldn't forget that pregnancy begins at the point of conception. And at the point of conception, you made mention of the fact that nipano emu. So moja and nsuo come together to form one at the point of conception. So any attempt to get that human being that has formed at that point, you know, is murder. And I say morally wrong, as we have established now. Now, some people think, say, some of these things are cannot. We don't really know what we are saying, because, as I said last week, people think, say, it's just a blot, and I said a blob of blood, and yes, something that really is inhumane. And I say it's not something that say cool be said. We understand that particular phrasing. So, and then we perceive some of the practices that are used to kill innocent children, and as innocent human beings who are formed in the womb. Specifically, you know, you share the two types. I know, say, you were the surgical, and then we have the medical. And you know, give us a brief distinction between these two types, and then we will delve deeper into each of them as we progress.
Okay. Thank you. Again, I have to caution people here. You know, even though abortion on its own very sensitive, the way they do it is even more sensitive and touchy. You know, because it's not even easy. It's not even easy for me talking about it. You know, what they do and you know what happens during that is a sorry sight. And I just want to caution, you know, as you know, say viewers' discretion here, you know, should be highly, you know, recognized as we talked about. You talk about these things. Now we have, you know, the medical way of performing the abortion.
Yeah.
You know, and then we have the surgical ways of performing the abortion. Now, you know, these ways, is based on the trimester. In fear about front Eddie warrior frumono, and then they determine the kind of procedure or more a.
Okay.
The internet is usually divided into trimesters. Okay, trimester means
yeah, you say obafa ye kunu a abosome nkunu ana. So usually 9 months ana obafa ye kunu a odi.
Yeah,
and that 9 months
38 weeks.
Okay, so Momo, you want to restrict it, and you like it in weeks, but we understand it in months.
Yeah.
It's in a 4 months, So, what you check months into 3 different cycles. So you call the first trimester, and then the second trimester, and then the third trimester. So quickly, first trimester begins from week 0 to week 10. Give us the week breakdown.
Okay, so the first trimester is usually that conception to the 12 or 14 weeks.
Okay,
depending on how you count it. Count it free the time of your last menstrual period about 14 weeks, and then 2 weeks after about 12 weeks. So it's going to be the same, so I'll say from 0 to the 14th week. That'll be your first trimester. Okay. And then of course the second trimester, will be from your 14th week to the 28th week, around that. And then the third trimester from the 28th week to to 40th week. But there are overlaps, some people will say from 0 to 12, from 13 to let's say 24, 26, from 26 to, but the idea is that 0 to 14, 14 to 28, 28 to 38, 24, 40. In that order.
Okay. All right. So, so you said depending on the year, the trimester na obano, and also nipa na wafa ye no or wono, that will determine which medical procedure the of abortion that will be administered to terminate the pregnancy. So, just give us a breakdown of that. Give us more information on that.
Okay, and if a year, obviously, the first trimester, I feel about frano, on the early stage of growth, and at that stage, usually you don't need any aggressive, procedure. And more year abortion, at that stage, they use 2 main abortive abortion procedures. Medication, or what we call dilation and curettage or curettage, that DNC.
That's right.
And in the first trimester, usually, medication usually from 0 to maybe around 9 weeks. About frano usakra, now from 9 weeks to the 14th week, or my dilatation and the curettage or curettage, the DNC. Into the second trimester, I'm afraid be dilation and extraction, the DNE or the DNX. Okay. DNA and DNX. One of our friends in Kakra into the draw manner and here. I mean, the idea is so I'm a friend in my Obano and other complications. And no, I'm afraid of dilatation and curettage or dilatation and extraction. DNE or DNX. And then the third trimester, my friend in the honor, again, in detail. And the honor, but friend, went to man a draw, went to DNC, went to extraction, so usually they open the woman up. Okay.
Wow.
Sometimes, sometimes they can inject a medication on the wab of front panier. Now, bofrana ewu, bofrana ewu ye funimu, above obana de be our bofrana. So the child will be the third trimester. And we are going to go, into in summary, yeah, in the first trimester, no, a drop any D and C. Second trimester, just D and E or D and X, dilatation and extraction. And now, the third trimester, we have labor induction or laparoscopic surgery. Open the lady up and then doing the surgery, bringing the child out.
Something from the old canning, it tells me something is striking. It tells me, say, you see, as the trimesters increase, you realize that the procedures become more aggressive.
Yep.
And they become even more inhumane.
Exactly. And it's sad, I'm going to show you some pictures, some video, and it's very, as I said, it's a sorry sight, what we go through. And that is why, who go through, after the procedure and their life never becomes the same. Even for
you are in the medical field, so you understand some of these issues. So, like people who have gone through some of these things, you are saying, say, it even affects their mental state.
It affects everything. It affects everything. In fact, it affects their mental state, affect their social interactions. It affects their health. It affects even their spiritual orientation.
I was reading an article online, and I found out there almost say about all 20% of I'm kind of saying pregnancies in the United States like end up in abortion, excluding miscarriages. 20% end up in abortion. And then I was wondering, say, what were doctor, I know, say, not all doctors, let's put it on note, say, not all medical professionals and as a doctors perform these abortive procedures. And that is just a caveat. Me de took on now. Or Chinanko Bianco say, hey, said the Dr. Sarfo HH the media, not just say, or Kai,
yeah.
No, I just want to
exactly. Thank you for that. I don't do that, and but I know it. I've studied it.
It is part of your curriculum, so you are trained and you are taught and all those things. You know all those procedures, but because of your higher standards, you choose not to do certain things. We commend you for that. Just putting that one out there. So I just want to find out sometimes, what are some of the main reasons in Tia Obibeba or Babeba say, even at the third trimester? I just can't believe it. What are some of the common reasons you have you hear from your colleagues say people give in Tia they want to go ahead with abortive procedures?
Yeah, thank you for that. I don't know if you know this debate going on, the pro-life and pro-choice, debate. Pro-life means that, save the child, right? Pro-choice means, I'm a woman, it's my choice. I do whatever I want, So these are the two mainstreams of abortion versus anti-abortion. And if you look at the pro-choice, more, like a person we were from now, most of the time, reason is more or less like emotional reasons.
Okay.
Reasons the entire man go for abortion, it's from the argue from emotions. Okay, the argue from emotions. My mom reason me said, you rape me, for instance.
Okay.
You rape me, Anna Minimie. About friend or shame a rape about. How do I deal with this child? Because me want to cry now, I'll always remember how I got the child. And if you think about it, right, they appeal to people's to your emotions. And so you want to say, yeah, right? One you want question because and of course sometimes we feel their pain, and I do feel their pain. start, what harness or TMia, next or report with that, and I say, you are thinking about it, you have to really think twice, because right, what have you done? So I also step on the faith power. You have to really plead to God. You have to pray and fast, so that God can erase that bitterness from you, because one month contrary, that money, it will always be on you, but God can forgive, and that emotions, go for bad, they make that complaints. Okay, so that's another reason. Another reason could be, like ABR, so no, especially Africa for to know and I fire home and you say bear more into the incest. That's another reason. Where's that reason where again appealing to your emotions, right? Appealing to the emotions, the same thing. We all about Majuma say, right? I was working, I thought say I can make it. Now Majuma say about friend burden, me to take care of the child. Just imagine about friend we are background now. Again appealing to your emotions, right? Appealing to the emotions. Obi was say, oh yeah, I'm planning, which is very common. Even among married folks. Even among married folks. Like, I'm planning, and I'm saying, I'm planning, I was saying, I was saying, we are not ready for it. Just imagine the first one planning, I was have a friend out. So that's another reason. Another reason go for a man say, oh, man, I didn't expect it. Maybe 40 years, maybe 45 years, maybe 48 years, and I'm not going to then person go through this kind of complication via men also they also we was me yare me yare way I was saying fair drobi man fair dro na behame abofra but there also ego. Well, I have cancer no chemotherapy. So we have all these reasons and go for Emma, to go ahead to terminate a child. But point blank, it's my choice. It's my body, it's my choice. I don't care. Okay. Those who are very mean, they will tell you that, my body, I made a choice. You have no right to decide for me.
That's
where other reasons then come forward, the man say, oh, okay, communication is about friend home, about friend in ye any other day, no ye dear, any some of friend friend in ye or nay dear, I mean it drew me say we try me from I don't want to go through surgery. And if you can do something to it. So again, these are some of the many reasons are conformer, to go through the things that we are going to be talking about. Yeah.
But I quite remember say of all these reasons now, last week you made mention of the fact that of all the reasons now are coming in, there are very rare legitimate reasons in here people would justifiably need an abortion. And I don't think that the old boy falls under these very rare, even with those emotional appealing reasons in Ankoforman. I don't think any of them falls under the very rare reasons. It might justify an abortion.
No. And even when I talk about these things, I don't even have anything to tell you that falls under that rare condition. If you realize that I don't even give you any one. So it becomes case by case scenario, right? It becomes case by case scenario, because I cannot tell you that because of this, that, even those rare conditions, as a physician and then of course as a spiritual person, I should look at what you're presenting. Okay, I cannot just say okay, yeah, okay, let's do this because what can I say when into it's justifiable? No, it's not. Even one. Okay, even one of those rare reasons, because a case scenario is a case scenario. Okay, people, and I remember I said some time ago I had this, kind of verbal altercation with this lady, and that was my prime period age when I was in school, And again, it was very heated, you know, and very sad too, because the lady was arguing from the standpoint of emotions, and was saying something like that. So if about frano ebe kun obana about frano ebe ma obana wua, do you expect me to keep the child if it will be if it will be if it will be, you know, lethal, if you will be if I will dead in the course of the pregnancy? I mean, the question is, who determines who dies? Is it the child or you? Who determines who dies?
Yeah.
You know, if you want to be Anna, who determines? If you have a choice, of course, obviously, also then the child has a choice too.
Yeah. I think that is another angle of the conversation people you're kind of saying, oh, I mean, whether I should say intentionally forget, and I said they try to forget. I don't know what to use, but they say that it's their body, it's their choice, as we know in America and all that. But what about the choice of the child, the innocent child, not that?
Exactly.
Yep.
Because a case by case scenario, and people even say, well, I'm a friend there from onya like want me kasa, you know, want me need on its own, nipa. Okay. So let's look at somebody who is on a ventilator in the hospital.
That's
Do we kill him? Do we remove the ventilator because he's not talking and eating? You know, so again, people, you know, we have intellectual reasoning, you know, concerning these things, you know, and emotional reasoning concerning these things. But I understand when emotions are into play here. You know, I understand it really well because I'm human. I'm a rational human being.
Yeah.
You know, but say the years you know, I'm also intellectually, or say I thought that we are safe for Nyansa Chen Christopher. Yes, one can say, yes, or more or bonimo Debbie. We have to be intellectually wise to make decisions.
Yeah.
And you know, it for about say my choice or one casano in other scenarios, you know, they will be the one to argue for in logic. They'll be the one to argue for what? For, you know, relativism, right? They'll be the one to argue for that. But when it comes to that, they become hypocrites.
That is where I find the double standard. So people are not willing to follow through their own because Sawokas will follow through the logical conclusion based on what they say. You realize that in other areas, you know, they wouldn't be logical. They wouldn't. Very few people will go through it in that way. Thank you so much. Other possible economy, videos, so said they're kind. They are very, very cryptic, and I say disturbing kakra. So just before that, you know, viewer discretion is advised. We will show some videos here, show you exactly how some of these things are performed, even some of the tools that they use. In fact, who tools maybe a while big, and for a human being to go there and seek the services of a medical doctor to perform some of these things, to me, it's really telling. Like, it makes me wonder why would people do that? Instead of maybe a doctor said, what are some of the reasons that people come to the hospital to ask for some of these procedures to be done on them? And he has listed a few reasons, but none of those reasons, as we have seen, actually is justified morally and scripturally. And so let's take note. Something we're joining a Chariot TV Action Time. Kwasi ada nyumwe bia 8 o'clock yaja konya ehwehwe ensem ba kwa na mienu bi ne. And as if it's last week, we've been looking at abortion from the medical perspective. We will be also looking at it from another angle. So just stay tuned. We have so many things packed up for you this year, and then we are looking at some of the procedures, medical procedures that are being used in abortive processes. We have established, say, abortion of any kind is morally wrong. And we have also established, say, Onyankopon is against those who take innocent lives. So that point has been well made. If you have any questions for Dr. Obetimi at your comment section, as they come in, we would read them. I think a few comments have come in. I will read them before we proceed with the discussion. Yeah, the boss, Chandra Kupon, is watching from NP. NP, no meaning what the NP stands for. Boss Michelle, brother Richard Donko, another boss. Then the bosses no almost sending me shout out. God bless you, brother Richard Donko Nyakupon in Shawon. So Edward, I'm here. Also watching from Burkina Faso. Wow, Burkina Faso. That's the northern part of our neighbors in the northern part of the country. Edward Ichel Bibre. Vera entry bar for us watching live from Akona and Kwanta for Yamamunina Ajo Yadamase. Yes, sister Emilia, and so sharing live. Emilia, Yankopon in Shapa Papa. So Anna Felicia, and so sharing all the way from Tadi. Ichamunina. Yɛbɛto nkɔmmɔ twetwe no so ɛnua aba Felicia Achia nso ɛhwɛ live from Ajamasu ko nyinaa Nyankopɔn nhyira nti no yɛbɛsrɛ sɛ afei no waba a like ɛyɛ page no. If you have any questions, Dr. Elhan say we've been looking at the different types of abortion, and we are also looking at the various kinds of medical procedures that are used in abortion, and he has established that depending on the trimester or one and a procedure you would be given. So in all these things, let us not lose focus of the fact that we are not here to endorse the practice of abortion. We are here to shed light, expose the practice, so that people come to know the truth behind abortion. We would sum everything up in our subsequent episodes. But and then we are looking at it from the medical viewpoint. It's Mama Yenshen and Son El Honor. Dr. Mama Yatway and Komo. So you said, depending on the year trimester Bano, a woman, more a year procedures are more Emma. And I realized as the trimesters increase, the procedures become more inhumane and as a more aggressive. So can you let's zoom into the various trimesters and then talk about the specific procedures. If you have any videos to show us and so on, obey to me, then we can make progress.
Okay. May I say, into her first trimester now, the first initial weeks, my friend say from 0 to 9 weeks, around that time, usually what they do is that now you don't have to be in a clinic or a hospital for this. Usually more draw now coffee in a day or two, you come back to make sure say now let me say this. Some more in so many ways say no now abortion in that early stages naturally okay. Naturally unyankopon sa ade na enu ne prevent no naturally a drop to say misoprostol no natural substance be a wo in the pedue mu a se oba ebe wo a eboa emma abofra no de be eba. Okay. You call them prostaglandins.
Okay.
So prostaglandins a natural substance be a winnie pedue anymore, and it causes ripening, cramping of the uterus. Abofra no also about out the quickening power of delivery. Some substance be prostaglandins plays a role. We have prostaglandins, we have oxytocin, and all those substances helps bring the child out. And guess what? In Nipa green when you say oba person ye bofre egua or my substance nibia that at that early age, between the oba no nafi I ripple the uterus no na abofra na de aba.
Nti sɛ mete wase yi a onyankopɔn nyansa mu no sɛ ɔbaa nyinsɛn akɔpem sɛ ɔbɛwo a anaasɛ deɛ yɛfrɛ no labor sɛ awo aka no.
Yes.
Nneɛma bi a onyankopɔn de ahyɛ nipadua no mu a ɛboa ma ɛyɛ awoɔ no aka ɔbaa no obɛtumi akyem ama contraction take place na afei akwadaa no atumi afi yɛfunu no mu aba abɔnten no. Saa hormones no ana nduro a nkurɔfoɔ de anaasɛ ebinom de ɛyɛ abortion no saa hormones no na ɔmo afɔm no in a way a ɔmo de I'm kind of saying quicken the process of labor and after the process of abortion. I don't know if I got you right.
Yes, exactly that. Also, about front of your phone, right? And you know, naturally, no, or body body no produce those substances, no. The child is not ready to come out. And you know, they are bringing the child out prematurely. To do that, you know, you give that woman that substance, and I was say, and through labor produce no the man early to bring it out.
I see.
Okay, and we call that, you know, misoprostol. We have another one, mifepristone, which is also another medication. And nobody can have more medication. Omodi ma abana a preventive progesterone. Progesterone is a hormone. A wo obani mo asabo friend beto uterus no ma e mani nyini kama. Enti no mo sa mifepristone ma obana a bit scavenge progesterone na obani be holding no so be anya de be produce. And this a holding a dia any about friend nyini or friend nyini dia be dey about. Intina yes, intina the ma obana omo twen 1 or 2 days. Intino ko clinical no my examine so maya and son of day. The second drone a repo uterus no you can was na ma no. So almost scavenge almost comment almost show a comfort, right? Because it's like see show a comfort. Yeah, sharp but for comfort. Because say what is so so next what don't say man so in floor, what will happen? You're causing the you know that person to die.
Yeah.
And it's a drone the kind of the mawa a stop obana produce sa progesterone no. Into about frano into the child will drop. And after 2 days, you know, a doctor is a meal. Next or more about a friend Maya, no more sad the second drug night, dear bay amount. And it's so sad. Think about it. We are nipa next year how much so mina. Say a show come for. Look at how you feel. Look at the struggle. It's the same thing. You know, like it's come to a pan be more so now if we have not this have so say it's no no. It's come to pa. So it's
and akwala no oni kama for oni obia obeka bibiama no he or she is so innocent and just because reasons but could be I found it very you say man planning I will say worry for me ba almost akwala where they am planning into no just look at such a reason I just can't, and I don't know. Me who said I don't even know how to say it. I just don't know.
Into video back on the first trimester video, the first trimester video. Now about yeah.
Okay, all right. See, your best first trimester video. Now me careful for that thing. Wabaswa. Your best so share a link. You know, it's very, very important. Say this message goes out for everyone to hear it. So that we can be able to also reach out and expose some of these things that are happening. As far as abortion is concerned. We probably I think so maybe me share a video no na ma share but before that no So yeah, I think we bet me because me person share a video no. Then you can move on to the second trimester whilst I look for the video and then share it to our viewers.
Yeah, and one thing I like about this video is that the person who made the delivery, initially abortion. He's done over 200 abortions, over more than that, I think, and every time be on the conscience, even a doctor no on the conscience, and I'll say what the women also go through.
Yeah,
and to these videos to show say, man, this is evil. Wajai, he stopped doing that. He stopped doing that. It's a very humane and
I see. Yeah, Koso.
yeah. And so this early stage, even though about Frano, but about 9 weeks, 8 weeks around that time, so the last year every stage there is a life being formed. Okay, there's a life being formed. There has never been a stage in a child development that about friending, a life is being formed, a human is being formed. And using the medication to bring the child out, and so before you can to become right. I mean, one thing that women should know is that say no way and now we say, by when I say was say and share a corner before it's time. Do not rekindle life for its time.
Yeah.
Because if you rekindle life for its time, the same thing. And your time I was say, your time also womb be a crampy movie. So you are forcing it. So since you are forcing it, that womb can cause a lot of scars. The womb can even rupture.
Wow.
It can cause a lot of complications, for you. And if you're considering, say, what would do be the abortion, and so be advised you to do that. Mr. You have to think twice. Nafi enya against such if you say your advice say, definitely obey kasach in a way na be suit you, obey your day without really thinking about it.
Yeah.
But actually, what will happen to you, so maybe and see what you go through after, you cannot deal with it. So that's the first trimester, a draw. And the first trimester, answer, you were the dilation and then curettage. Now, the friend DNC. Okay, so DNC, and no say omoye clinics anymore. Now, what they usually do is say, more opinion of a urbano service. No say, and I'm saying, friend that womb or service when you're I am so beautiful, so nice. It's so tight. Tight say, my friend Emma.
Okay. Me who a video no first trimester medical abortion pills I think me place a video.
Okay, go ahead.
Okay, just hold on. I think technical issue. I'm trying to.
That's fine. Yeah, that's fine. We can, show it later. About a year, sir, DNC na. So me kai no Nyankopon in his wisdom was silly obano wumbunano. So the bear abofrana own free to think about it. Like abofrana own in strength, in weight, and we hear bibia a best sort of friend anymore. And Unyakupon your body to withstand that stress and that stretch. And DNC, what they do is that they dilate or more take part no much more beam. So
Nti eye awode na no na wo ka sisi a no.
Yeah, service yeah, wo na no yeah. Also
Okay.
oba no sebi oba ne ba no. Ufi ne ba no from the vagina no, you know, extra, that's where the service is.
Okay.
Into no no na ufi wa no akoto womb ni mu. Into service no na onyankopon protect no oma oba no that you know that you know strength to carry the child. Into no no na mu bie mu. Why? Because they want a passageway into one mu bie mu, that is the dilation part.
Oh, okay.
Okay, it be kind of vacuum aspiration or vacuum suctioning.
Yeah.
Some service, that's the dilatation, D part of dilation. Na afe no omode machine be a very high pressure, even about 10 times than the vacuum, the vacuum if you.
Hey,
The
vacuum
power.
cleaner na ye vacuum ye carpet so ne na se for no. Ero na omo use for that process no.
And no sa vacuum no more use no the power no is 10 times more than the vacuum use of you.
Oh, I see.
It's omo de share baby a omo bie na, then my brother, they suction the child out.
I see.
They suction the child out. And this is sad. Just imagine say what you feel na obi de vacuum kakaka be share odo ano. Not was suspended to this high pressure. Say, baby, I'll she be no sa pressure in your day. And you know, say on sako so and probably mukrana. Guess what? Because of the pressure, no, on Sunday bet right?
That's right. Yeah.
Uti bet it, una bet it, and that's exactly what happens to the child. So with such a high pressure, they suction, they aspirate the child out.
I don't know, sir. Video no, you bet me play this year.
Okay.
Yeah, my name say uhu o no more.
That be me who.
Okay. Eba. Okay. 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 Let's see. Me, but I believe say afe uhu.
Yeah.
And say as we go on, so person me post now make a year input to be able to me akache.
Okay, yeah, do we trust the medical one? At least I think say I've explained it, but yeah, make them more. Yeah.
Okay.
Yeah, mentee. So about mentee.
I want to one. Oh, okay.
Mentee say about. Ebo side yo.
Ebo on the side for there.
Yeah, mentee say about.
But video no code there.
That's so, but that's so no motion.
No motion. Okay.
Yeah.
Okay. I think that okay. So this is what I will do. Yen twaso. I think that we can show it later on.
Yeah, next week nearby. Yeah,
yeah,
you know we
yeah.
can. Yeah,
I think technical difficulties being, yeah.
Yeah, bit man show.
Okay.
Yeah. It's fine. It's but you know the idea, the first trimester, first trimester, two main ways, either by medication or by the DNC. Be my friend, vacuum aspiration, be friend suctioning. And medication you can the two main medication mudima backroom the mawa na a scavenger and I say a prevent hormones na a mabo friend.
Oh, okay.
And no mama bakwa ebema womb na idea be a shaky to rip the womb cerebral friend by day be free at all. And between the 10th week and then the 14th week, they can do the DNC. And na make us say, Omobie Obano service, Obano Anoa, Ufiwana quote, now would the womb,
Yeah.
So tight, Unyakupo iron to tighten up surveyable friend ring, a best sonimo. The way they say, Omobie, normal the session. And a session that make us say, we have vacuum, I did vacuum if you now. Sa holding na was our vacuum no. Sa sachet no is about 10 times powerful, more than that, powerful than the vacuum the vacuum if you. It's almost the service na feel no sachet or vacuum out from the and that is why it is very traumatic, and that we don't have. Doctor never got to say all those baby no he feels something and onyankopo Bible is onyankopo yensina twetwe, right? He feels say was it baby abortion bia wie bia no onyatinka bi onu say wa hwe bibi like wa ye bone kese bi. Now, he sees what these women go through. It's not ma motie me no na memma mo force.
Yeah, sorry.
My name is Dr. Anthony Levatino. Okay. I'm a practicing obstetrician gynecologist, and I've performed over 1,200 abortions. Today, I'm going to describe a first trimester surgical abortion called suction DNC, dilatation and curettage. This is the most frequently performed abortion and is used typically from 5 to 13 weeks of pregnancy. After administering anesthesia, the abortionist uses a speculum like this. This is placed inside the vagina and opened using this screw on the side.
Hey, sorry, when I say the BA awardie na no. Just look at that. A metal.
Yeah.
I see. Wow.
Allowing the abortionist to see the cervix, the entrance to the uterus. The cervix acts as a gate that stays closed for the duration of pregnancy, protecting the baby until it is ready for birth. The abortionist uses a series of metal rods called dilators, like these, which increase in thickness, and inserts them into the cervix to dilate it, gaining access to the inside of the uterus where the baby resides. The baby has a heartbeat, fingers, toes, arms, and legs, but its bones are still weak and fragile. The abortionist takes a suction catheter like this one. This is a 14 French suction catheter. It's clear plastic, about 9 inches long, and it has a hole through the center. It is inserted through the cervix into the uterus. The suction machine is then turned on with a force 10 to 20 times more powerful than your household vacuum cleaner. The baby is rapidly torn apart by the force of the suction and squeezed through this tubing down into the suction machine, followed by the placenta.
Wow. So just the principle of the vacuum machine, vacuum cleaner, that's the same principle.
Yep.
And we use how much aqualano with that force. Right? They don't pin in it. Oh, yes, some. Hey.
It's sad.
The uterus is mostly emptied at this point. One of the risks of a suction DNC is incomplete abortion. Essentially, pieces of the baby or placenta left behind. This can lead to infection or bleeding. In an attempt to prevent this, the abortionist uses a curette to scrape the lining of the uterus. A curette is basically a long-handled curved blade. Once the uterus is empty, the speculum is removed and the abortion is complete. The risks of suction DNC include perforation or laceration of the uterus or cervix, potentially damaging intestine, bladder, and nearby blood vessels, hemorrhage, infection, and in rare instances, even death. future pregnancies are also at a greater risk for loss or premature delivery due to abortion-related trauma and injury to the cervix. As I mentioned at the beginning, I'm Dr. Anthony Levatino, and in the early part of my career as an OBGYN, I performed over 1,200 abortions. One day, after completing one of those abortions, I looked at the remains of a preborn child whose life I had ended, and all I could see was someone's son or daughter. I came to realize that killing a baby at any stage of pregnancy for any reason is wrong. I want you to know today, no matter where you're at or what you've done, you can change. Make a decision today to protect the preborn. Thank you for your time. I will.
Yeah.
Wow.
It's you know, it's brother, it's sad. It's sad. What you know, and
It's here for action time. Share video kakra, and the video is very, very cryptic kakra. And if you look at the video and then you listen to what the medical doctor is describing, our perform such operations for so many years, I say a double could be it dawned on him, procedure about as you heard from him, not just say or whom the bones, the remains, now what suction, what kwalana ne dompe ne tine ne hone ne nine edda the hormone is seen so say we deal, and that is something that I don't know. It is forever on his hands, unless of course Osre Boniface fi Onyankopon chen. It's abortion, it is not just a medical procedure as it is touted as as I said, will be our yare malaria be our hospital near man drona malaria no echo debi. This is something more than that. It deals with taking the life of another person, and that is something. I don't know. I can see that you are dumb. I'm kind of say dumbstruck and kasa. But we will take the opportunity to invite a comment from our viewers. If you have comments, if you have even if you have an experience, we would want you to even share with us. If you can, share with the community. If you need help, you can also reach out. You bet me abwa in a way we can. That is why this program
by God's grace, anyway, by God's grace, we will be able to help anyway.
Yes. So, doctor is here. What question be and I say if you've gone through a similar procedure, and I say, some of these things, doctor, like you see, you can never get it off your mind, even if Osre Boniface and I say Onyankopon the domoa. You say that stain is still there. The conscience always reminds you. So we should be very careful and mindful in taking some of these decisions. I don't know what you have to say about it, but
yeah, and you're absolutely right. Okay, you're absolutely right. Sin has consequences.
Yeah,
and then the consequences stands a cut. But however, I believe the only redemptive way ubinya a bit to me I'm why peaceful and I know see you come medical and I know say we come about Bible they'll stress on this, but there's only one redemptive way why you which man do and that is through God. Even we are Christian you are still dealing with the guilt and bitterness and ye na akakra Bible no say adibi wo ha na de ban no empaibo any a country.
That's true.
And I can tell you emphatically, okay? I can tell you emphatically, if you're sincere in your remorse and repentance, na obompaya country, God will take the guilt from you 100%. 100%. not only even abortion. So kunipa bibi wa bia no say why dream say oba nyankopon nchen 100%. 100%. God will take the guilt because there's no way this thing that we just watched, this thing that we are talking about, no human will pass by the guilt. No human.
No.
You're going to live with that guilt the rest of your life. You need Jesus to take it away.
Wow. Okay, you have a comment section honum action time. Jumedi awhwe or Chariot TV so kwasiada nwumre 8 o'clock bia na yeshia na ya pensen one or two things when we are looking at abortion from the medical perspective. Menyam minia penny Listowell Sarfo or a medical doctor in the United States, and he has taken the time and the pains to take us through the medical viewpoint of abortion. And we have watched a very sad video. I think that any sane person wouldn't want to even have us, and as I have this on himself, say unknown why yes way, like the guilt itself, the guilt of bloodshed is too much. And if you look at the procedure, or the suction, I think it's about 10 times more powerful than what we use in our outdoor and as our indoor vacuum cleaners. It is too much. Like, I just can't believe it. I just can't believe that people go through such a process. And I heard that DNA now, we are normally a fat. Yeah, I would DNA scrape out the bones, the remains. Oh my goodness. And it is even, I don't even know how to even say it, but it was say exposing, so we have to say it. We have to say it. Comment biaba my boss Jonathan will say if doctor can look at contraceptives that can cause abortion, it will be helpful. I don't know. Jonathan Osanso de Bao say watching you live from Tema. Bema Arthur Derek also listening from KSTU. God give you more strength and wisdom to edify us always. I think messages be by earlier, but mankind. Bema Patrick K. Abe also watching you live from Asante Bekondo, a very another a friend is saying viewer of Action Time and Chariot TV. Nyakopon Shaw. Bema Derek Patrick, sorry. Magdalene in Cancer was well done, brethren. And these are the messages that have come in so far. We would want you to share your story with us. If you have, I know that it is hard. I know I can understand. But if you want to, reach from email chariottv@gmail.com. You can send us an email. And you are assured of confidentiality and anonymity. I assure you, if you have any stories like this, people think some of these things happen far away from us. Trust me, people are doing some of these things on a daily basis. As I said, the article that I read, 20% of pregnancies end up being aborted in the United States. This is a very serious, we are in an epidemic, a serious thing that is happening. This is just data in the United States. Ghana, the idea. And you see, Doc, what we are looking at so far, if you have noticed that we are looking at the medical ways. Also, there are other traditional ways, and those ones don't come. We don't have documentations to them. And documenting, people have all kinds of things they do. And we cannot speak to it. But people are doing things. People are doing things under the shadow of darkness. But in all these things, as we have seen, it is not the best. There might be another say what they want, as we normally hear from these activists. So we should be mindful of some of these things, whether over a draw, whether over a year, or hospital, no more used to these gadgets on you. Be mindful, say it is not something that is easy. You may just go in and have the procedure in about 30 minutes, but the guilt that comes with it lives with you for the rest of your life. Even afterwards, body fache. I don't know, but it is still possible. Say the doc amayati asiyano.
Yep.
Say
God can
so no matter what you have done previously, today is an opportunity for you to come back to Christ. Into the doc, I don't know, say I think this question came up. Name what you have to say about it before we wrap up.
Oh yeah, a very, very important question. I think I'm a very strong advocate for really looking into which kind of contraceptives to use, because a lot of Christians among the brethren, they have no idea that they are committing abortion every day. Okay.
Wow.
Because a lot of Christians are committing abortion every day. Think about it. Contraceptives, right? Contraceptives are of two main ways.
Okay.
Contraceptives work two main ways: either to prevent conception, or to what? Prevent progression of the baby after conception.
Okay. So that is before a baby is formed and after a baby is formed. Okay.
Yeah. It's why you tell me, what do you think? Which of these contraceptives will cause abortion?
After the baby is formed, and no
Exactly. But you see, you don't know. No one, you don't know whether the baby is formed or not. Right?
That's the gray area.
Exactly. And if you're taking any contraception, say abofra after his form, that is deliberate, because even though you don't know a child is formed, why are you taking it after? Why are you taking it to prevent the progression? For instance, the morning after pill. What do you call morning after pill? So no be other into ostrose be abofrano, abofrano benyam. I mean obenyam, right? The morning after pill, you have different types, but there's one mawa, for 72 hours or so, say conception is here, abofrano to be abofrano being progressive to the next level into look at IUDs. IUDs is inserted in somewhere in your womb, right? In your cervix, your vaginal cervix area, right? And the IUDs usually it makes the uterus uncomfortable for implantation. Abrabo front of to womb no sa and make that area uncomfortable. But friend to me stay because IUD a drone into the same idea. Banning produce hormones now a big keep up a friend the womb.
Yeah.
In the best now you cannot get pregnant. When you cry now, when you cry, say. So IUD, whether medical or device, it's we can talk about contraception in detail, but the main point I want to ask you, the main point I want us to take from here is that, of course, I'm not telling you, I'm not telling you to go and use contraception or not to use or you have to use them. I'm not saying that. What I'm saying is in view of our discussion, contraception be a mawo. The idea and says about funny for when we are about funny best say no. It is a form of abortion, right? Because the child is already formed. But you have to take care.
Yeah,
conception and money there. Of course, that's not abortion because the child, child is.
Yeah, I think said Doc, the point has been well made, and said most Christians, naively, and yes, they be a boapayo, what is the contraception, a family planning, said I can or in Chrome Hanum saying, say family planning, to know what Connie man say, said the family planning and all that, only want to also be brave. So or you Christoni and you say or person and answer something, but onim the mechanism of action of most of these medications. So I think that we would we would have to talk about it. Next week, we will squeeze in some time and then discuss into detail kakra some of these contraceptions. And we would also urge people, say, please, responsibilities, it lies with you. So if you are taking and as you are being prescribed any form of contraception, it is your responsibility to find out what is the mechanism of action. And I say, so if you're able to determine it, then
we should ask questions, brother. Even though because ignorance of the law is no excuse, right? And that's why the Bible says what exactly. That's what the Bible says. What again? Or see, we are a foreman who nyansa as a Christopher.
Yeah,
trust me, a Christopher. We do things without asking questions. We just do it because we think that it's okay. So we should ask questions. I'm not blaming anybody. Say what you can carry, But I will say one day also because we work okay business here. On me home say a best Christo ni ana enso Christo we say oh na say me no unsa but store na me no man ton san go for ma like blatantly Emma onya Christo for support on say ana boni be no so no unsa Christo for every store omoton the cigarette na they right
yeah
but sana I mean you don't see anything wrong with that. So the same thing. With our soul cancer, we should ask questions, okay?
Yeah.
In detail. Yeah. Ask questions because your salvation is at stake.
That's right. Your time no call. You better a doctor say papa say what you brain and then so no on akasa. Yankopon ya adom next week see ba you better ye nkomo twetwe no eso. In fact, I have learned so much, especially from the video. Sometimes you read also you are able to get a picture of what the thing looks like, but when you see it in a video form and as a diagram form, it really brings the thing home. And as you can really perceive exactly how it is. And we just saw one of such videos. It is not our intention to maybe cause any form of emotional unpleasantness by showing these videos, but it is for the purpose of education, the purpose of showing light, and as exposing some of these practices. So that we see it as it is. Now, I know ye be anyone who say abortion, and I said these processes are inhumane, and we should avoid them. Yankopon said we shouldn't shed innocent blood. And clearly, abortive processes are one of the ways we shed innocent blood. Which other life is more innocent than the unborn child? Only come for, only dima for. Now you take such an inhumane decision on the child, and because of so many reasons, as we have seen, they are not justifiable. And next week near Barbetos. But before I leave, remember, Doc, I'm on the final words.
Okay. You can say Bible say you will no man in our coin and in a fatay. Me nipa ho adwuma, but many excuse say maybe beer and so Onyankopon ni. The Christian first. I'm a Christian first before a physician. In the foot on the man and say bibi esi especially young man no. Mestre because toda reasons na no man almost emotional, idea and I feel your pain. So be a poor, and I say for some reason now a very it could be very devastating, but the show crying said the Onyankopon enim ye ya no se bibisa or abortion is never your first choice, because say we are the consequences never best worse than say nkawe de be keep over frano the bomb person Yakopon shame modern on shame na den se de be ya ibetumi hu de was ye o asetre mu na boy ne anifo onenim in the massive.
Yeah, that one so has to be very Dr. Sarfo Nyankopon Insha. yetie for nya hwepo nyina yeda mu nyina mu ase Nyankopon ya adom a ochina Chariot TV ebeto a program no eso Tuesday and so another program. So just stay in touch, be with us, join us whenever we come on live. You will be able to access our programs. We have so many things in store for you. Moma yenchen and so Nyankopon ya adom next week ebesan so aba or question or comment. If you need help, you can reach us on chariottv@gmail.com. Send us an email, and we are promising you of confidentiality and anonymity, especially regarding this topic, which is a very sensitive one. I know that some people would want to comment, but because of the public nature of our platforms, it's very, very hard for some of them to comment on some of these things. But we encourage. If there is any way we can help you, you can reach us, and our doctor is here, and we also have other able brethren behind the scenes who would also avail themselves to be of help to anyone who has trouble. Action time in Nyankopon eya adomwa dasene yebesanso abamunchen yakra mu nyina